Hello everyone. Today we have with us one of the eminent doctors from Ranchi, Dr. Prem Kumar. Dr. Prem Kumar is Senior Consultant Urologist and Uro-Oncologist from Ranchi, Jharkhand. Dr. Prem Kumar has a rich experience of 15 years in the field of urology and oncology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. Dr. Prem Kumar is currently practicing at Ranchi Urology Center. It is the first single specialty clinic for urology in the state of Jharkhand. Welcome, sir.
Thank you for your kind words, and special thanks to Forbes India for providing this platform to talk about this interesting subject which we will be coming on to. Thank you.
Thank you, sir. So we begin with the interview, sir. Going ahead with the first question. Sir, now that life expectancy has increased, how has it changed the prostate cancer scenario in your clinical practice?
What is seen is that every male, as they go ahead and the age increases, they have a micro focus of cancer prostate. Maybe it doesn't turn out to be a clinical cancer prostate. So what happens if our longevity increases? So with age, the number of prostate cancer will increase. Other thing, now we have good detection tests like PSA, MRI, and also PET scan now. So all these things now, it has caused an increase in the number of patients which we are detecting. It's not the actual increase. These patients would have been there earlier also, but now we are able to detect the disease early. So definitely there has been increase in the incidence of cancer prostate patient as patients are living longer and we have better modalities to detect this disease.
Right. So can you tell us something more about the PSA test?
Yeah, see, PSA is a wonderful test. I think it's one of the great tumor marker. And it's called PSA is prostate specific antigen. Though it can increase in benign prostatic hypertrophy, that's the normal prostate we talk about. Then it increases in chronic prostatitis or acute prostatitis, that is infection of prostate. But now what we are using PSA is mainly for, it is for cancer prostate. So suppose there is a value, say it's 4 nanogram per ml. That's a like baseline. But that doesn't mean a patient above or below may not have cancer or may have cancer. But then it's a screening test. So by doing regular screening test in patients, especially whom we suspect to have cancer prostate, or say suppose who has a familial history of cancer prostate, or suppose they have even history of breast cancer or ovarian cancer in related sister mothers like that, there I think PSA becomes more useful. So PSA along with digital rectal examination is I think is a very important instrument to detect cancer prostate early.
Right. So apart from aging, what are the other contributing factors that lead to increased prostate cancer detection?
I think we don't know much about the risk factors of cancer prostate, and we don't know what that really affects. People say less or more of lycopene and carotene probably will decrease the risk of cancer prostate. People started taking more tomatoes. So like that, but there is no specific risk factor for cancer prostate as such. So, but what is important is some certain areas in the world and certain groups, population groups, they have a higher risk. I think India is not among that. But most important is if there is a strong family history of prostate cancer early in life, say in less than 60 years, less than 55 years, and where the severity of disease was bad and the disease was high grade, that's a risk factor where we should be observant. And then we start PSA monitoring at 45 years. Even in risk group, you can start at 40 years. So otherwise, we don't know much about the risk factors like we have in other diseases, say bladder and all, kidney. We know smoking is a risk factor. But here, there is no obvious risk factor.
So what are the kind of clinical symptoms that a patient presents with?
It's very difficult to differentiate prostate cancer from the normal prostate, which we call BPH. See, both of them will have a similar symptoms like, say, obstruction in voiding or frequency in voiding, painful voiding. They will be holding some urine night. They will be getting up again and again. But maybe probably some patients may have more of a bleeding tendency. Maybe they will have blood in urine. And suppose if the patient presents quite late, maybe they even can present with retention urine, or if it has gone to other organs, they can present with bone pain. And it's quite common in India that people present late when they have bone pain. They start having weakness in lower limbs. They lose weight. These are the presentations of late disease, which is common in our rural population in our country.
So, although in the first question we've already touched upon the diagnostic parameters, but still, can you, little in detail, tell us about the diagnosis of the condition?
See, anybody who comes with lower urinary tract symptoms, that is prostatic symptoms, we primarily do a ultrasound, we do a PSA, we do a routine urine test, and we do a digital rectal examination. So once you are suspicious about cancer prostate and you get an idea from PSA, then what we do is, earlier we used to go for transrectal ultrasound, but I think now it's a test called multiparametric MRI. It's a more specific MRI for prostate. I think that's the investigation of choice. And once we have a MP MRI done and that is suspicious of cancer prostate by scoring, that is PIRAT 4 or 5, then we go for a transrectal guided ultrasound, transrectal biopsy, which is mostly ultrasound guided or fusion ultrasound. And then you come to a final diagnosis, it's a cancer prostate. And now there is a facility for PET scan. I think it's commonly used in India now. And we can go for a PET scan for exact stage. That's called PET PMSA scan. So then we can go for exact staging of cancer prostate.
So, what are the different treatment modalities or surgery options?
What happens in any other cancer, everything depends on the stage of the disease.
Right.
So when we detect cancer prostate, it starts from stage 2, because stage 1 is coincidental finding when you just do a prostate surgery, that's QRP. So then that's stage 1. Otherwise, when we start diagnosing cancer prostate primarily, it starts with stage 2. So that is something, it's limited to prostate. Stage 3 is just outside the prostate, and stage 4, it will be metastatic, going beyond prostate. So patients who are in stage 2 or maybe early stage 3, then especially the patients who are like less than 75 years and who have a life expectancy of 10 years, that is the criteria. Like a patient who has a life expectancy of 10 years. So we are not just going by the chronological age, we are looking for the physical age. Like how fit is the patient. So suppose if the patient is fit and the disease is localized or locally advanced, then what we try is we go for a curative treatment. So once you have a curative treatment, either it can be a form of a radical prostatectomy where you remove whole of the prostate and maybe the nodes around it. That can be simply by open prostatectomy, or it can be laparoscopic, or it can be robotic. These are modes of surgery, but finally you have to remove the prostate. A similar treatment, which will be nearly equivalent, will be, those surgeons may not like the statement and the radiotherapist will tell that radiation is better, but I feel radiation is also a good choice, and that also has a curative intent. So if we are going for a curative intent, then we have to do a radical surgery of prostate, or we have to go for a radiation. But if the disease is advanced, then probably we have to go for hormonal therapy. Now there are newer drugs acting on androgen receptors, and then there are chemotherapies.
So, what different kind of chemotherapy drugs do you use?
Actually, see, prostate cancer is something like breast cancer, which is more related to hormones. So initially we go blocking testosterone. Like there are different drugs like abiraterone, enzalutamide. They are oral drugs and they work on the hormone. But chemotherapy, we have drugs like docetaxel. I think that's the first line chemo, and then go for cabazitaxel. So that the medical oncologist decides. So when to give, but usually docetaxel is given first, and if it fails, then later on we go for cabazitaxel. But they are really a relatively safe drug.
So, how have you handled your patients during this pandemic time?
See, usually the OPD also patient were aware they were less of OPDs. Initially, many people didn't do rectal examination like that and all. But we have been we have been seeing patient continuously, and but we started online OPDs, so now we cannot examine the patient. So we went more for investigations. We have to do a PSA because you cannot see the prostate. But somehow, like there were more of investigations during this period. Follow-up was more by online, but many people did not get medicines what we wrote, so they were substituted. Many patients missed their medicines. Things kept on going on, but I think now things have improved. The OPD has improved, but it was a bad time for the cancer patients.
So, sir, last and finally, would you give any advice or recommendations to your patients how to face their situation during this pandemic time?
You see, if the symptoms are manageable, then fine, you don't come to a clinic. But suppose if the symptoms are severe, you need a doctor. I think that's important, and especially now the disease, especially in our country, is quite under control. So I think there's no situation of panicky. Just take measures like proper distance, masks, sanitizers, and all those things. And especially for cancer prostate, actually the stock was on that. So what I will recommend is for every male, they should ensure that they get a PSA at 50 years at least, if not at 45 years, and then make sure that they keep on getting PSA tests done every 2 to 3 years. And people with family history, they should definitely get a PSA done by 45 years, and then keep on getting done PSA every year. I think that's how we can detect cancer prostate early and probably and save a number of lives. Because cancer prostate is the second commonest cancer in the world, but the mortality is fifth or sixth. That means with cancer prostate, you can live. And obviously, if you detect cancer prostate, probably you can live normally.
Thank you so much, Dr. Prem, for this valuable time. And indeed, it's been a very, very fruitful and informative session. Thanks a lot, sir.
Thank you, ma'am. And thank you to folks. And thank you to you all for taking this interview, and especially for the awareness it will make among the population. Thank you so much.
Thanks, sir. Thank you so much.
Thank you. Okay.